Dr. Savitra Misra, ma'am,
Yes, sir.
could you able to connect?
Yeah, I connect to my son's laptop. Okay, my laptop is not able to connect. Maybe I
Okay.
don't know.
So, but still, still you are in. Still, you are connected with your mobile, I think. Or
Yeah. I just got log out from the mobile and
shall we start the program? In case,
yeah.
if,
Yes, sir.
in case if you are having any problem, I can operate your PowerPoint from here.
No problem. My in second after that, sir.
Yes.
Okay, no
Second, you are.
problem. Can start now.
Yeah. Very good morning, very good afternoon to all the participants. This is the webinar on reopening of schools safely amidst COVID-19, being organized by Child-Centric Disaster Risk Reduction Center, National Institute of Disaster Management, Ministry of Home Affairs, Government of India. And we are organizing this webinar, I think. Yesterday, the Government of India came up with the Unlock 5 guidelines and saying that the schools can be reopened after 15th October. And they have given a lot of guidelines related to reopening of schools, like getting consent from the parents, and the state government can be taken their own decision to reopen the schools, and it's and this online education also can be continued. So even this online education is being continued, we need to ensure the right to education of a child, and their learning should not be disrupted. So the reopening of school is must, and we need to think of it. So this is the right time to discuss about the reopening of school safely amidst COVID-19. And there are a lot of good examples also how we can safely reopen the schools during this COVID-19. Like in Jharkhand, at the one of tribal district, the school teacher, what they have done is, in the street side, they have used uh, all the platforms which is being constructed by the people has been used, and the walls were also being used as a blackboard. And so by maintaining a social distancing even in tribal village, if they could able to reopen the schools, then why not in other places? So by taking this as an example, we can now reopen the school safely against COVID-19. And let us discuss some of the points which we need to consider while reopening the schools. So with this, my brief introduction, now I would like to introduce about Mr. Mr. Bangu Bihari Sarkar is a program officer, risk and resilience, UNICEF Bihar State Office, and he's working with UNICEF as a program officer, and he provides a technical assistance to government of Bihar in program implementation, assisted government of Bihar in the development of SOPs on floods, drought, and fire safety in hospitals for improved preparedness and emergency response. The development of management plans, Bangu played a key role in development of the roadmap for disaster risk reduction 2015 to 2030 of government of Bihar, assisting government of Bihar in the implementation of Chief Minister's School Safety Program, covering all the government and private schools in the state, reaching to approximately 30 million children. And Bangladesh initiated DRR Academy in collaboration with Bihar State Disaster Management Authority, so as to continue the DRR and resilience building in the current COVID-19 pandemic. He has 20 years of experience in the development sector, of which substantial experience is in humanitarian and disaster risk reduction, including designing and implementation of scaling up of DRM model. He has responded in many disasters across several states in India. He has written several guidelines, manuals, case studies, and articles which have been published in leading journals and magazines. This is a brief about Mr. Bangu. Now I invite Mr. Bangu Bihari Sarkar to discuss about the reopening of schools safely amidst COVID-19. Mr. Bangu, sir.
Thank you, Balu. And I would
I'm
thank
handing over to you, please.
NIDM for giving me this opportunity to talk about.
Kindly
yeah,
on your video, sir,
yeah,
if possible.
to give me this opportunity to discuss the most talked about topic right now is reopening of schools. And I think this is the discussion which is being done by the children and by most of the parents. And we have seen that this has been there is a dilemma basically whether to open the school or not to open a school. And there has been a lot of discussion around this topic also. And recently I saw that private schools in Kolkata, they also did a basically an assessment or maybe a rapid discussion with the parents, and in which I think 95% of the parents said no to the opening of the schools, though the schools have actually said that we have put in place several measures to contain the spread of the COVID. So now I will actually talk in more detail about this reopening of a school, different perspective. And I will put my perspective as an UN employee. And as you may be aware that UN resident of coordinator's office has supported Ministry of Human Resource Development in developing a guideline for reopening of schools. So I will just give you a brief synopsis of that guideline. Balu, is it visible?
Yeah, it's uploading. It's uploading. Yeah, you can make it now maximized. Yeah.
Yeah, I have done it.
Yeah.
Okay. So we need to see that how the what is the impact of pandemic basically on school education. If you see that COVID-19 pandemic has caused unparalleled disruption to the education globally, and more than I think 1.5 billion students globally have been affected by COVID pandemic, and more than 463 million students are unable to benefit from the remote learning. Though there has been a lot of efforts has been done by several countries and several states in India also to actually reach out to the students with digital learning, and a lot of innovations have also been done. I think recently Ministry of Home Affairs, Ministry of HR, MHRD has done a very good documentation on the kind of digital learning which is happening in India. And we understand that the school closure will again impact the education of 286 million students from primary to secondary in India, and more than 6 million girls and boys who are already out of school children prior to the COVID crisis. So many children will be pushed out of the school, maybe because of several reasons also. And so this 6 million may again actually become maybe 10 million or 8 million or maybe 12 million. Nobody knows it. And as we understand that as per the UNCRC, the rights of the children, that child's right to education is actually being compromised during the last 6 months of the pandemic. And if we see Balu, can you change the slides?
No, so you are sharing, no, so you
Okay,
have to.
okay. So if we see the digital learning which is actually happening. So during the school closure, MHRD, NCRT, and several state governments, they took proactive measures, and they actually established different kinds of platforms for digital learning, be it through national television channel like Doordarshan, and maybe radio or maybe FM channels, as well as WhatsApp groups, and some of the states also did they developed mobile application also. It was basically an effort to continue education during school closures, and HRD also released an alternative academic calendar for primary, upper primary, secondary education to basically guide children's learning. And we also saw that the CBSE and ICSE board also, they also reviewed the curriculum and also tried to reduce some of the actual chapters. And we also saw that some of the state governments also took proactive measures to continue the provision of midday meals. And though schools were closed, but the money provision of money for the midday meal was actually transferred to the bank account of the parents of the children. And but we have seen that during this digital learning, there is a huge inequality in access to education, because there is a huge segment of the children who are actually the ability and the access, or maybe don't have the hardware to access the digital learning. So that's really a big concern, that these children who are actually already at the margin will further be actually detached of the education. And why do we really are talking about reopening of the schools? So as we all understand that the longer vulnerable children who are actually out of school, they are less likely to return. And we have seen that there are several million of children who are quite irregular also in attending the schools. So again, there are great chances that these children may actually not be able to return to the school. And we all know that prolonged closure will also continue to disrupt essential schools based services, which cannot actually be done through the digital learning, be it health services, be it your MDM, or be it the practical classes, which can only happen in the school premises. And we also know that the disruption to instructional time between the student and the teacher interaction in classroom, this can have a severe impact on child's ability to learn and their overall retention in the school also. And as well as we know that learning online through other channels, it has a limited reach, especially among the most vulnerable. And there are a lot of other critics that the attention span of the children in the digital learning is again a big question. And we don't know whether the digital learning, how much the children are really learning. So there is no study actually which can actually say that digital learning has not been very fruitful during this period of time. But maybe in the long run, we can actually understand what has happened during the closures. And then again, we know that being out of school children will again increase basically the teenage pregnancy or the gender-based violence. And we have seen there has been actually increase in the crimes also. And we understand that there may be forced migration or human trafficking, child marriage or child labor and other threats. We also understand that having to look after the children at home, maybe the school closes, some of the parents may be also not able to actually go to the or opt for the livelihood options, be it Manrega, and particularly those who are in the actually poorest communities, which will negatively impact the children's overall growth and the well-being. And we also understand that during this closure, there is a lot of stress and anxiety, and due to the loss of peer interaction or absence of support from teachers or school counselors, and disrupted academic routines, and which we can see that this stress or anxiety may result in some psychosocial issues. And we all understand that negative impact will be significantly higher for the vulnerable children who are from the scheduled tribe or the scheduled caste communities or minority communities, or maybe children with disabilities, or children with limited or almost negligible access to digital media, or children who are actually living in very crowded slums or maybe hard to reach areas, where definitely these children's vulnerability will be much more higher as compared to the other children. So when we are discussing this reopening of a school, so there are several actually key considerations that need to be discussed prior to taking a call on reopening of school. First thing, we all understand that reopening of a school is critical, particularly for the most vulnerable children, because they are the segment which is being left out of the digital learning which is happening. And we all know that school reopening must be safe and consistent with the overall COVID-19 health responses. And we all know that in India, we still don't know whether we have actually reached to the peak or not, or as well as we still don't know that when the number of cases will be reducing. So the situation is very volatile, and we don't know whether how long it will take to change this situation. And we all need to also do some key conditions about the state specific measures and conditions, as we have seen that there are several states where the number of cases have actually reduced, though there are other states also where the number of cases are also rising. So all reasonable measures need to be taken basically to protect children, students, and maybe staff or teachers and their families. And the timing of school reopening should be guided by two basic principles. One is, it should be kept in the mind to keep the best interest of the child in mind before actually taking any decision on reopening of the school. Second thing is the overall health consideration. So these are the two basic principles that need to be actually followed. Then only a decision can be taken for reopening of school. Then if we see overall public health consideration is also an issue which need to be taken, as we understand that there are several states or especially the states which are actually poor, where we understand the health services and the health infrastructure can't do the there's only an outbreak cases is actually coming due to the reopening of school. Maybe the health infrastructure may not be able to actually provide the services, and that's why it's very important for consideration that before reopening of a school, a very I will say robust analysis or assessment of the associated benefits and this need to be done, and for which definitely it's important for to have interaction with the teachers, schools, students, communities, basically to understand how they have been actually coping with the pandemic during the closure, and what about the digital learning and other things. Wherever possible, decision-making process would be actually devolved to the local authorities. Any decision taken at the national level or the state level actually will not work. So that's why it's very important that the decisions should be actually left at the local authorities, maybe at the block level or maybe at the school level, so that the reopening of the school should be based on local context and should be responsive to the evolving situation and needs of the on the ground. Because even in a district also the conditions of the block, different blocks may be different. Hence decision maker need to actually do a kind of assessment, basically how learning and well-being can best be supported in this context. And we all know that the context is changing very fast, and benefits of classroom based instruction vis-a-vis remote learning. And third is the risk factors related to reopening of schools need to be also considered, and then infection risk related to school attendance. So these are the four key factors that need to be actually assessed by the decision makers across the country, across the states or across the districts. Some of the key questions for benefit risk analysis, which I talked about earlier, before reopening of the school. So now I will talk about some of the risk factors that need to be kept in mind while taking a decision on reopening of school. What is the capacity of the school, including residential schools or the hostels, or even your mother's, to maintain physical distancing? Because physical distancing is a term which is I think is one of the core we see the behavior or the protocol that need to be adhered. It will actually largely depend on the size of the classroom compared to the number of students. And we know that in most of our schools, be it government schools or the private schools, classrooms are actually cramped or maybe packed with the students. And we have seen in several states the average attendance is almost around 55 to 60%, when we see that the classrooms are actually packed and the children are actually sitting on veranda. And suppose if there is 100% actually attendance in the school, then maybe students will not actually get space to really sit. So in this condition, if we see how do we really maintain physical distancing, then ensuring adequate water, sanitation and hygiene facilities. As we all know that in most of the schools we find either one hand pumps or maybe a gender segregated toilet, one toilet for the girls and one toilet for the boys, and which may not be sufficient if we talk about COVID context. And there are only very few schools where you will find hand washing stations. Then basic health and psychosocial support facilities in the school. We all know that majority of the schools don't have any facility for health or basic psychosocial support system. Then what is the ability of the school to disinfect classrooms at regular intervals? Do we have the provisions? Do we have the facilities? Do we have the budget? Then will the physical distancing further stigmatize? We all understand that there is a section of the population, they are always subjected to actually because of their caste or maybe religion, they are also always subjected to be discriminated. So this kind of discrimination or stigmatization may further actually there are chances to be increasing if we start maintaining physical distancing. So these also need to be kept in mind while talking about the physical distancing. Then the teachers or the students or the support staff, they can actually travel safely to their school and then go back to their homes. This is important because we all know that there are huge chances that using the public transport will definitely has a high risk of infection. And we all know that most of the government schools, this kind of transport facility is actually not available. What related risk factors? We understand that whether the school is in any zone, then are there sufficient healthcare facilities within that area? Are this area densely populated? Are the people still really practicing physical distancing? As we understand that that majority of the actually areas during the relaxation or the unlock period, we have seen that the people have now become I think relaxed, or maybe they are not actually following or adhering to the norms, which is actually expected of COVID. So these are some of the risk factors that actually need to be discussed, assessed before taking a call for reopening of a school. Then some of the risk factor, some of the factor benefit analysis we need to see that how essential it is that classroom instruction to achieve the respective outcomes. And we have to also recognize that the importance of direct interaction with the teachers. So this need to be actually very well assessed. Then how available and accessible is the remote learning for a specific age group, or the children with disabilities, or children from the marginal, most vulnerable groups, or the marginal groups. How many children can't be reached through online or digital platform or social media? That need to be actually assessed. If we see that majority of the children are actually being reached through the digital platform or online media, then definitely it would not be a good advice to reopen the school. Are parents or caregivers given and guidance on how to support the learning at home? In the similar way, how long can the current remote learning approach be sustained? As we understand that this remote learning is a very newly innovated things, and is still majority of the states are doing a lot of innovations, and they're still learning actually. So if it goes for a long, then we don't know whether they will be really able to sustain or not. Including learning achievements and the social emotional well-being also need to be thought through. And as we all know that there are actually a lot of domestic pressure on the parents also, and other context-specific factors. And we all know that there are some schools where when schools or the part of the schools they decide to reopen, can the state government take some critical policy decisions? Because there are certain policy decisions that need to be put in place before reopening of a school, which I will actually talk about in my subsequent slides. Then are there actually alternative or available or any way to replace the laboratory work or the practical work or physical activity, which is actually essential for the child's development? These are some of the questions for the benefit analysis that need to be kept in mind while doing the while taking a decision on risk, the benefit and risk analysis. Then again, do the parents have the necessary knowledge and tools to to actually protect children from online harassment? As we have seen that there has been a lot of actually issues with the online harassment or the buddy system, where children are being actually harassed while through online platforms. So this is also a threat for digital learning. So that also need to be actually assessed. Then how efficient are teachers in providing remote learning in absence of proper training and equipment? As we all know that it was actually beyond any imagination of anyone's that this kind of actually digital learning may happen sometime this year, and that it actually suddenly started, and teachers have been actually put in asked to actually go through this provide do the this online or digital learning. But actually proper training has not been given, and they have not been properly equipped also. So definitely now the time has come when we need to really assess the efficiency of the teachers in providing remote learning. And then how ready or able are teachers and education authorities to adapt to different administrative and learning approaches? As we all know that if we take a call to open the schools, then different administrative and learning approaches need to be put in place. And so whether the system is actually ready or not, then there would be a lot of issues related to protection risk to children. be it increased risk of domestic violence or sexual exploitation of girls and boys. That is an issue which is also being talked about, and there has been a lot of actual discussion around it. And we also know that the school closures, does the school closure actually compromise other support services, which is being, so that also need to be thought through. And what are the social or psychosocial, economic and well-being related implications on children if they are actually not attending a school physically? So these are some of the questions that I am putting forward to you. While taking any decision, you need to do a benefit and risk analysis, and while doing that analysis, you need to actually ask these questions, and based on the answers, you need to analyze and you need to take a call whether we should actually take a decision to open the school or not. If you decide to really open the school, so there are actually six basically dimensions that need to be actually thought through and planned very holistically. And these six key dimensions are basically, one is policy. So there would be several policy decisions that a state or the national government has to put in place before taking a call of reopening of the school. It's not just one guideline, it's not just one order of reopening of a school. Then there will be a lot of actually issues around financing. And this policy and financing is a cross-cutting which will apply to all the four actually pillars or for the decision making for school opening. One is the safe operation. So I will actually deal with these pillars separately in more detail, and then focus on learning. Then focus on learning, and then reach the most vulnerable, which is I think a bigger concern for reopening of a school, and then finally well-being and protection. These are the six pillars that need to be thought through, and then it's very important that all these six pillars, you need to put in place certain activities prior to reopening. Then certain activities can be done by as part of the reopening, and certain activities can be actually done with the school open. So on safe operations, there are certain considerations that need to be done prior to opening. Like you need to prepare policies, procedures, and financing plans, which is needed to improve the schooling for safe operations, including strengthening remote learning practices. Because still we can't actually rule out that once the schools are open, the remote learning practices will no longer be required. Maybe you have to take a decision that after a few days of running schools, if you take a call that okay, it's not working, so we need to actually take a call that we have to again close the schools and we have to go back to remote. Just wait. Bob, is it visible? Hello.
Yeah, visible now.
Okay, so these
Maximize.
things need to be these policies, policies and procedures and financing plans need to be actually put in place so that the safe operation can happen, where government has to provide very clear guidance on parameters for decision making on school opening. And then government also need to develop a lot of protocols and plans for students
Yes,
and
sir.
teachers transportation also. And then again
No,
the
another
school
person
opening
going at the time moderating.
can be progressive, and in the beginning it can actually start
Yeah, I
with
was
the
joined
areas.
because in between I was trying to connect. Uh, 10 minutes I can try now. 10 minutes I can spend now. I will try. If everything is fine, I will exit by. And in case.
That is coming. Okay. Number we have interaction with number going on very well. Okay.
Okay. So can I try now or can I come after?
Hello.
Mr. Bangu sir, you have any problem?
No, can I continue? Because there was some disruption actually.
No, you can continue. Sorry, you can continue.
Okay. So then again, school opening could be progressive. Maybe it can begin with the areas where there is a lowest rate of transmission. And then a school opening can also be staggered. Initially, limited to few days of the week, or maybe apply only to certain grades or level. Like in Bihar, we have seen that the government of Bihar took a decision to actually open schools from grade. This Monday, the schools have opened, and as well they have said that it will be around 50% with 50% attendance. So this kind of actually experimentation can also be planned. And then a school that have actually have already appropriate infrastructure and supplies in place, so those schools can be given a priority. And because unless and until you have infrastructure and services in place, you cannot actually just hastily take a decision to open the schools. Then as part of the reopening, definitely efforts need to be made to bring in the marginalized and out of school children back to school. That should be a priority. Then one need to actually invest in water sanitation and hygiene to mitigate risk, and then again focus on some remedial education to compensate for loss of instructional time. And for this they actually need to invest, and this will be part of the reopening to basically strengthen a communication with the parents, children, and on education matters. As I already said that unless and until parents don't agree, they won't be sending their children to schools. So that's why it's very important to actually engage in communication with the parents and the children on this issue. And they may also, education department also need to conduct a back to school campaign, basically because as we all know that there is a huge fear around actually it. So that's why a clear message about safety and protocol that is actually being put in place, be it for water sanitation hygiene or be it for infection prevention control. And this kind of messaging can also go to the communities, so that it will actually address the kind of fear that is there in the community. And they also need to engage with the school management committee or the child protection committees in the villages, or the panchayati raj institutions, or the community leaders or adolescent groups in this campaign, so as to make it a kind of community-led campaigns. Then even while the school is actually open, so with the reopening of the schools, they can actually actively as well as focus on well-being and protection, because this will actually help them to take a call whether to continue with the classes or to discontinue a kind of decision. They also need to also work on the pedagogy as well as adapt or remote education with some blended teaching or learning education. And that they also need to actually continuously work on displaying communication material on COVID-19 prevention in different areas within the community and school premises, which will actually help the children as well as the community to understand the nuances. They also need to engage with teachers and children in maybe producing masks or maybe developing communication materials, so that will actually help the children's building confidence also. And they should also try to promote some understanding and adherence of protocol and norms, which is very important. So otherwise what will happen, that slowly they will actually forget the protocols or the norms, and they will start not following it, which will again be create a disaster situation. Then as I said that and for safe operation, it's also very important for them to develop clear and easy to understand protocols on physical distancing measures, because physical distancing is one of the things which is being talked about, and which is one of the important protocol norms for the COVID, and in which they can also take a decision on prohibiting activities for mass gathering, like maybe prayer, or when the school reopens, and then they may be staggering the starting or the close of the school days, and it can be in different shifts also. And they can also that like midday meal, where again the gathering happens, so that can also be planned in a different way. And again, moving classes in a temporary spaces as outdoors if the climate permits, or maybe in some other community halls if they can actually have access to all those things. They can also try to have a school in shifts to reduce the class size, or maybe having provision with addition of some community spaces also. So these are some of the things that need to be put in place prior to reopening of school. Then they should also actually test the safety protocols with teachers and staff, so that to just to make themselves understand whether they are actually having full understanding of these protocols or not, and before actually taking the final call of reopening of school. Then they should also actually invest in training the staff, teachers, even a school management committee, as well as adolescent groups on, as you know that in several schools there are actually bal sansad also members on implementing physical distancing and school hygiene practices. And as well as they can also have some MDM protocols also. So MDM protocol need to be really revised to context, and all the cooks and the helpers, and as well as the suppliers, also need to be trained actually on these new protocols. And they also need to take some measures for physical distancing while the school is actually going on, based on the experiences which they have, like keeping the same group of students in the same classroom, or maybe increasing spacing between the students in the class, and limiting the number of students in the class if they are running in shifts, maybe holding the classes on alternate days. These are some of the actually suggestions that can be done for safe operation. But these three actually like segments prior to opening is very important. And then again, which can go as part of the reopening, and which can go when the school is actually opened. Then if we talk about focusing on learning, so as we all know that there has been a huge loss to learning loss. So how do we really cope with learning loss? So that's why there are some policy decisions which need to be taken, like they need to provide teachers basically school principals also with support and training on remote learning, because this is something which is extremely new, and they need to be provided adequate training. And as well as government also need to actually put in place a kind of budgetary provision for increasing investment in actually remote learning, which can go beyond only ICT enabled solutions and platforms, so as to actually prepare the schools for future rounds of school closure, and strengthen teaching learning which may not be reaching to the vulnerable sections. So certain innovations can be done. How do we really reach to the vulnerable students? Then they also need to review the remote education platforms and materials for their accessibility to children with disabilities, because this is something which is actually still, I think, missing piece of work. Then as part of the reopening, so again, revise the admission guidelines policies of the RT, and in which definitely they need to eliminate all the barriers of entry, because as we all know that there has been a huge migrant influx in several states, and there would be a lot of extra children who have not been part of the education system. They would like to be enrolled in the schools. So all these entry barriers need to be actually eliminated, so that these children actually can be accommodated in the schools. Official recognition of the alternate learning, whether it's through WhatsApp, whether it's a mobile application, whether it's digital learning, whether it's through television channels. So this also need to have some official recognition, so that accreditation or certification processes can also follow. Then as part of the reopening process for the focus on learning, they also need to provide support to the parents for actually seeing it's a new actually practice of digital learning, so where the parents need to be actually engaged and encouraged to engage children for digital learning. While the school is open, definitely supplement instructional hours with a blended model. It's not be classroom teaching, but it could be some of classroom teaching and some distance learning can also be thought through. Currently, we are not doing any blended model, but definitely blended model could be a kind of future mode of teaching. Then implement innovative teachers support methods also, where they can also think that if we actually invest in building the teachers skill building, so that they can actually which can be part of their pre and in service training, because currently the teachers pre or in service training doesn't include this COVID context and even the digital learning. So this could be part of the teachers training, which is actually happening in every state. Then if we talk about the well-being protection of the children, so this is very important, that providing teachers and with support and training on handling crisis and stress management, because they are also part of the community, and they are also going through the same kind of stress and crisis. So that support need to be provided by the state, and in which they definitely psychosocial support need to provide to students while schools are closed, and self-care to effectively manage the impacts of crisis. These are the two things that need to be actually done prior to reopening of school. So as this will actually build confidence of teachers and the school principals for opening of the schools. It will not be just an order actually. Then as part of the reopening of the school, increase the provision of mental health and psychosocial support services. It's very important that they need to put in place a mechanism within the schools for addressing these psychosocial and needs, and for which they need to train teachers so that actually they can actually handle the question and answers that a student will be asking to the teachers, maybe regarding COVID, or regarding infection prevention control, or regarding water sanitation and hygiene. So teachers need to be properly trained to handle all these questions. Then there should be very clear, concise and accurate information about COVID, because we know that there is a lot of myths and there is a lot of misinformation which is actually floating around on the social media and even in the WhatsApp groups also. So that's why it's very important to actually share very clear, concise and accurate information about COVID, and then create a safe environment for a student and teachers so that they can actually talk about their fear and anxiety. And if they, as much as they can talk about their fear and anxiety, it will actually help them in coping with the situation. And then definitely promote self-care strategies, which has been missing for long. And then they also need to review and strengthen several referral systems, be it referral to gender-based violence, or maybe protection against sexual exploitation and abuse, or maybe the services for child-friendly and accessible to all children. So these are some of the things that they need to put in place regarding well-being and protection of the children. Again, it's also very important that we have seen that teachers are not being paid salary for months. So this is actually against the well-being protection of the teachers also. So it's very important for state government and the national government to take a call to ensure that timely payment of teachers' salaries are being done. So it will actually also help them to mitigate their precarious, actually they are going through the kind of stress, or it will also help them to avoid absenteeism and promote well-being of the teachers. And if possible, they also need to think through eliminating certain examination fees or any other monetary contribution from parents for schools, as we understand that the government should also provide all categories of schools with some grant in aid to sustain themselves. And we know that there are several schools, especially private schools, they are actually going through huge financial crisis. And then maybe create a contingency plan for the distribution of midday meal, because again it will be a preparedness for reclosure of a school if it happens. So if this kind of contingency plan is already put in place, so distribution of midday meal can actually happen smoothly during the reclosure of the schools. And then as part of the reopening of a school, they also need to conduct a risk assessment for teachers and other staff, and because they are also human beings and they are also part of the community and the society, considering their age, then maybe chronic underlying any health conditions or comorbidity and other risk factors. And then actually accordingly they can actually have a plan to implement it in their schools. So this will actually help the teachers building confidence, and the teachers being part of the society, teachers can also see their values. Then also provide mental health and psychosocial support, not only for teachers, but students, teachers, as well as the school staff. And they also need to re-establish certain other services, be it like IFA supplementation, water sanitation hygiene services, or any health services, whether it's deworming, malaria prevention, or oral hygiene, or any vaccination campaigns. Then again promote and reinforce health and nutrition education as part of the school reopening process. It's very important that we all know that school reopening is being talked about basically to reach the most marginalized section. So that's why it has been kept as a separate pillar. So that's why it's very important that we need to have target funding to students who are most affected by the crisis. It could be a cash transfer, whether it's a conditional cash transfer or unconditional cash transfer to the students, maybe as an add-on or maybe top-up. Maybe through provision of free mask or free uniform or textbook. Then adapt school opening policies and practices to basically expand access to marginalized groups. Engage and coordinate with other line departments who can actually play a very critical role in school services and attendance of the most vulnerable. As we know that in several states, there are different commissions which work for either, whether it's a scheduled tribe commission or scheduled caste, or maybe a Mahatarit mission in Bihar. So they work for a particular part of the marginalized sections. So those that kind of coordination actually will help to bring the children from the marginalized sections to the schools. Then as part of the reopening, again, as I said, that eliminating barrier for entry, and we know that barrier for entry is very important to be eliminated, and otherwise the children will always not be part of the education system. Then they need to also take specific measures to support girls into the school. Then the return and enrollment of children with disabilities is very important, and children who are actually have migrated with their parents, then they may also would like to join. So specific measures should be put in place to help them to enroll in the schools. Then also ensure that these learning platforms, materials, information services, and facilities are actually accessible to children with disabilities also. So maybe material could be adapted for these children also. And then while the school is reopened, they need to also prioritize financing to support new recovery needs, especially for disadvantaged children. Maybe some remedial education need to happen because there could be children who have not been part of the, who could not actually access digital learning. So there is a huge learning gap. So to actually meet those learning gaps, remedial education or catch-up classes need to be done. So this also need to be planned. And then maybe household survey or access can happen to see whether the children who are actually to identify the out of school children and then bring back them to school or enroll them. Then also plan for continuing education for children with disabilities if schools are again closed. So these are some of the things for reaching to the marginalized section need to be considered. And some of the next steps that I would like to just as a closing actually my presentation. So based on all these premises, a decision, final decision can be taken for reopening of the school. Hence, one need to actually design and implement a very effective response plan to reopen schools. It cannot be that just a decision to reopen the schools. Then response plans for the reopening a school must be designed according to the contextual realities. And this contextual reality will vary with the state, with the district, with the blocks. So these contextual realities need to be kept in mind, and a single order will not actually suffice. And then appropriate protocols and checklists based on the local context need to be actually developed and implemented. And planning must consider the context of the school also. Every school will not have the sufficient infrastructure and the facilities in place, whether it's a pre-primary, elementary, secondary, or higher secondary. As well as the location of the school also matters, whether it's urban school or the rural school. And other factors, whether the concerns of the students, teachers, and the parents also need to be considered. That's why I think everywhere it is being said, even the government's unlock policy also says that with the consent of the parents, children can actually come to the school. So that's why it's very important for us that while reopening of the school, these need to be considered. And then based on the assessment of the context, decision makers in the state or the union territories, they actually can make a choice or informed decision to prioritize actions to reopen schools and ensuring that the schools are safe for children as well as the teachers and meet the learning and the well-being needs of the each boys and girls. So these are some of the things that need to be considered while reopening of a school, and it's not a very simple thing that any decision can be taken on any day, and that okay, now you can open the schools. So thank you so much, Dr. Balu, and over to you.
Yeah, thank you for the idea on your presentation how to schools and what are the what are the guidelines they have to follow before reopening and now I request artists any questions please you can put it in chat box. There is questions just so that we can answer. And one person has raised a question that after reopening of school, if a student get infected, what because need to be followed. So question you got my question, sir? It's from Prabhu Sivaprasad.
Sorry, your voice was cracking actually. Your voice
Am
is
I
cracking.
audible?
Can you repeat?
Just a minute.
Yeah, now it will.
Okay. Mr. Sivaprasad has raised that after reopening, if student get infected with COVID-19, what precautions to be taken by school?
I think if Mr. Prasad have seen my extra slides carefully, so one can see that before reopening of the school, definitely a school need to put in place these system for providing health services, or maybe having a coordination with the health department, so that the child can be immediately isolated and linked to the health department for proper treatment. And again, as I said, that reopening of the school is not a very simple decision which can be taken overnight. Reopening of the school can only be taken with consideration of the several things which I discussed right now. Over to you, Dr. Balu.
Yeah, thank you for answering. Hope the participant got the answer. The second question is from Revis. He raised that how a child with anxiety will show good result when he is not comfortable in the classroom.
See, first thing is that when the school reopening will happen, definitely the parents' consent will be must in the initial period. So if the parent comfortable to send their wards to the schools, they can take a call not to send the children to the school. Second thing, as I said in my presentation, for the well-being and protection, all the teachers should be provided actually training on psychosocial support or anxiety to address anxiety or fear. So definitely this will actually help the teachers if a children is actually fearing or have a lot of anxiety or going through some psychosocial issues. Definitely the trained teachers would be able to handle the situation. Over to you, Dr. Balu.
Yeah, thank you. Mr. Bijit has raised that the latest guidelines insist that the parents should give written consent, retard the process.
Will this?
This is the parent give a
Yeah.
written consent. Will this retard the process? Retard, RETARD.
No, I don't think it will retard the process. It's very important that the consent of the parents is taken. I think I will say it's a very welcome step, because otherwise what will happen, that parents because of their own negligence, if they send their children, if they are not comfortable to send their children, government is actually not forcing anybody to send their children to the school. And if the parent is given a consent, it means that parent understand the kind of risk that a children may face while going to the school. And as well as parent will not actually make government responsible for all these things. So this is not the process which will retard. Actually, I think it's a welcome decision. I will say it will give a lot of autonomy to the parents to take a call for the future of their children.
Thank you. So only one last question. Is that do we provide yoga and physical education activities to improve physical fitness when school reopens?
Yeah, I think it's a very good decision as an exercise, and definitely I think I missed it actually. So yeah, it's a very good session, and it need to be included in the school when the school reopens. Definitely, it should be part of the curriculum.
Yeah. In addition to Mr. Bangu, I also would like to answer, and all the schools are having a physical education and a PT master, and they can implement it regularly in the school. It's not only this COVID-19 situation. Regularly, they are doing such practices, and this can be increased now. It can go for more practical sessions for to make a physical fitness among the students. Thank you so much, Mr. Bangu, for giving your valuable time. I think now let's move to the next presentation. Hope you will be there till the end so that in case in future if you have any questions you also can answer at the end of the session. Uh, Thank you, Mr. Tangu. Now I would like to introduce uh, Professor Dr. Savita Misra. The she has impeccable records of 17 years of teaching and research activities. She's a dedicated, resourceful, and goal-driven professional educator with a solid commitment to the academic growth and development of every people teacher. She has been motivating teachers and students to come up with innovative ideas for the progressive development of teaching learning process. She is committed to professional ethics and standards of practice and keeps herself abreast with the latest developments in teacher education. She is continuously engaged in organizing national and international level conferences, webinars, and workshops for dissemination of knowledge and expertise to the stakeholders of education. She has written more than 70 research articles in reputed national and international journals and authored 23 books. Wow. She has also developed a psychological tool for assessing attitude towards science. She is the Vice President of Council of Teacher Education, Eastern Zone, Scientist IAC, a member of Board of Studies and visiting professor of some of the universities, including Academic Staff College, and she has been conferred to the title of leading educationist of the world by IPC Cambridge, London. I'm very proud to introduce you, ma'am. Now I'm handing over to you this session, please.
Thank
Yeah.
you, Dr. Badu sir,
Yes.
Manoj sir, Santosh sir, Sarkar sir, Kumar sir, and Dr. Badu sir, or each and every member of the and dear participants. As you know that we are discussing today on very important topic because this is a matter of concern that when we open the school, we are planning to open our schools. So it is a matter of concern of the protection of our teachers, students, and each and everyone associated with the school. So Sarkar sir has already discussed in very detailed about this. I just want to add something in this topic. So Baru sir, can I share my PPT?
Yes, now I have given you a role as presenter. In the bottom, the third icon, share. Before that, you open your PowerPoint in your desktop, minimize
Okay. Okay.
WebEx, open your PowerPoint,
Yeah.
and now maximize the WebEx. It's uploading, your content is uploading.
Yeah. Is it visible?
Just a minute, ma'am, it will take. Yes, you can maximize your PPT.
Okay. Yeah. Is it visible, Dr.
Yes, ma'am, it's visible. Now you can go ahead, please. Dr. Savita ma'am? Dr. Savita ma'am? You are not audible. Are you there? Dr. Savita, are you there? You are not audible. Dr. Savita, are you available? You are not audible. Dr. Savita, am I audible to you? Dr. Savita, am I audible? Ma'am, am I audible to you? Dr. Savita Misra, am I audible? Your mic is unmuted. Muted, please. Yeah. Am I audible to you now?
Visible, sir? My
Please.
PowerPoint PPT is visible, sir?
No, you have to share once again, please.
Okay, just a minute, sir.
Oh,
You give permission to, sir?
oh once, yeah. Again, I think. Just wait, I'll change your rule. Yes. Now you are the presenter, please.
Okay, sir. Now it is visible, sir?
Yes, visible. Yeah, please.
Okay.
You can start from the beginning. Yeah.
Sorry, participants, due to internet problem. So already Sarkar sir has discussed the reopening of school safety, and I just add to some points. So as you know, that academia is facing the most terrifying and testing times ever, that not only caused shut down academic institutions but also made people difficult to breathe across the world. And this pandemic has not only brought in pernicious impacts on cognitive functions, physical and mental health, but also has further shattered our daily routine, lifestyle, and all activities across disciplines. So furthermore, the global lockdown to contain the virus has caused an immense interruption in students' learning, internet assessments, final examination, Consequently, the cancellation of final exams and assessments for qualification by a substandard option. So you have seen that now students are giving the online exams, and it is not up to quality, but we teachers are trying to make it as a when situations will become normal. Uh, Till then, we have to continue the education system, and to continue education system, we are taking the exam also and test also. But the epidemiologists and scientists have shown concern about its future prospects and would remain active if the corona vaccine enters the market, which may probably take a year or so, despite claims by the University of Oxford, USA, China, and India, to name a few who have already started human trials. If it becomes true, we need to think to open our education institutions to function normally that still seem imaginary. But we need to prepare to set up standard procedures and operating mechanisms to follow while starting the new phase of teaching and learning in face-to-face classrooms at campus. Various tentative measures to be taken from planning to implementation from teachers, students, parents, administrators, curriculum, technological, health, and environmental perspectives before and while reopening schools, colleges, universities, and other academic institutes across different states and an appropriate time. So, sir, Sarkar sir has already discussed so many government plans and the operations on which basis we can open the school. So, I will take some from administrative perspective. The tragic outbreak of coronavirus has started a conversation across the world academia about complex issues ranging from students' mental health to classroom environment in the academics, which is most only enormously a major concern in India, but also the source of a significant part of global challenge internationally. So while the widespread students' anxiety, demotivation, and lack of interest are linkable to the anxieties generated by the pandemic, it is also pre-existing fact that the ill-equipped, unwatchful, unprepared, and lack of vision of institutions have been leading causes for damage occurred to students' learning. This goes on to emphasize the weight of responsibility on the administration into the student's problem. There is responsibility to find out what actually went wrong to these lapses and unfitness and what we have to do it. Openness, sensitivity, and responsiveness to genuine teachers and students concerned are key parts of maintaining high standards and consistent learning, although not to be confused with incapability. The announcement of government new guidelines should give an adequate time for schools, students, parents, and teachers to plan or prepare, because without clear advance warnings and instructions, we could create further uncertainty for schools, students, and parents. So every time you have listened the new guidelines from the governments, even in a way
Is the session is audible? Can any participant put it in the chat box? Is it audible? Okay. Some problem. Let me check. Uh, I regret for the inconvenience. I request all the participants kindly wait. The presenter has some technical issue, so the audio was not available, and she also exited from the platform. I request the Dr. Savita Misra to join again. So kindly wait. By the time, if you have any questions related to this session, you can put it in the chat box. Uh, till the time we can discuss. Actually, before reopening the school, as the government of India has given the guideline, we need to get the consent of parents. So unless if the parents are not willing to send their children to the school should not force the child to come to the school. So as far as convenient, I feel that we can go with the online education to ensure the safety and security of the children from this COVID-19. That will be the best way. And the elder adolescents, like, I think she's back now.
Share.
Yeah, you are audible, ma'am, now.
Yes, sir. Please give option again to share my PPT.
Yeah, sure, sure. Yeah, the role is given to you. I think it's
Yeah,
due to poor network connection.
yeah. Yes, Yes, sir. I don't know why today is so that every time with this problem. Is it visible, sir?
Yes, yes.
Okay, so I don't know where participants. I'm very sorry, participants. I don't know from where that didn't you have listened.
You have now around 40 minutes time with you, or
Okay,
half an hour you have because last 10 minutes we can have for a discussion. So till 3:50
okay.
you can make your presentation. So
Mm, okay. So, dear participants, we will start from this administrative perspective.
yes,
So
ma'am,
you know
please.
that, yeah. So you know that we are passing through the very that difficult situations, and when we open the schools, it is each and every member of the society of the schools. It is our duty to that first concern is the safety of the students, and after that, with the same like we have to give safety of our teachers and each and every member of the schools, and from that we have to that. Take also we have take opinions from the parents, from the administrative, from the each and every member of the society. And when we open the school, we have to think from each perspective. So like first we have to discuss about the administrative perspective. So you know that the tragic outbreak of the coronavirus has stirred a conversation across the world academia about complaining issues ranging from students' mental health to the classroom environment in the academics. Again, sir, audio is not clear. Sir?
You are
Oh, okay. Thank you. Because message I have seen that audio is not clear. That's why, sir.
now you are
Okay. Thank you, sir. Okay, so while this widespread students' anxiety, demotivation, and lack of interest are linkable to the anxieties generated by the pandemic, it is also a pre-existing fact that the ill-equipped, unwatchful, unprepared, and lack of vision of institutions have been leading causes for damage occur to students' learning. Just a minute, if it is not moving. So the announcement of government new guidelines should give adequate time for schools, students, parents, and teachers to plan and prepare because without clear advance warnings and instructions could create further uncertainty for schools, students, and parents. The government should also build a consensus between school leaders, parents, leading educationists, and medical experts within the sector around the safety principles that need to be put in place within schools for a smooth and safer reopening. All concerned authorities try to navigate conditions existing and falling ahead carefully to evolve much better strategies to facilitate free, fair, protected, and ensuring the well-being of all attendees. The institutions are bound to protect all attendees attending classes during the frightening and difficult times by infection control, hygienic environment, and campus sanitization, hand washing, mask wearing, and keep social distancing. We do suggest schools discuss their genuine concerns and provide assurance of the measures they are implementing to trim down the risk in school. Now, from the teacher's perspective, what teachers are thinking about the reopening of the schools amidst COVID-19? Quite often, teachers have not given due importance in the policy decisions and other related matters. It induces anxiety, frustration, demotivation, and fear of losing jobs because they are the ones who undertook a Herculean task and spearhead the remote teaching online on virtual platforms without given any time for planning and reflection. And as you know, we teachers were never trained to impart education through online in this, but in pandemic situations, when one day's lockdown, teaching learning process is never locked down. And even teachers were not trained, but They have tried, and now they are successfully conducting the online classes, online tests, and the other activities also. So the pandemic has affected the closure of all schools across 185 countries by the end of March 2020, affecting 90% of the world's students. The teachers have prepared and worked tirelessly through these testing times, connecting with students and parents to compensate for the damage done by the dreadful virus. They have displayed a high level of professionalism and acumen to support and render services to teach and keep students learning continues on priority, sacrificing their own comforts and personal responsibilities. And as you are aware that many teachers have not the devices, not the smartphone, but still they have managed, they have sent their precious things and they manage the devices and the smartphone to continue the education. So the our students will not debar from the teaching learning process. This makes authorities to pay their struggling life, selfless service and efforts put in, and discuss with them their problems and announce a few constructive measures to ensure their personal safety, security, and future prospects. The teachers in turn would surely take care of students' health, safety, and all new related issues facing schools while reopening. Today, we need to develop a STOT system giving autonomy to teachers and institutions with a special focus on faculty professional and training program for both inspiring them and providing emerging technology inputs to undertake any task instantly in adverse situations. Now from a student's perspective, because our main concern is our students, and you know that in the pandemic period they are undergone the high stress and the psychological problems, because the present in a situation our students are well equipped and conversant with the mobiles devices and technology and its uses, especially social media applications. It facilitates them to move to online learning on virtual digital platforms. Unfortunately, there is still a large marginalized section of communities and students who are hit the most and tend to exacerbate the inequalities already existing in the society. And whatever that Sarkar sir has already discussed about these students from this section of society. And this is a dire need to think to reach each student to ensure and protect the right to education. Most of the students face loneliness, isolation, frustration, depression, boredom, and a poor experience because of lockdown, which has kept them away from social interaction with friends and society. A few faced difficulties in learning management system based learning approaches, missing out many sessions. The schools should ensure students uninterrupted learning on reopening along with broad and well explained guidelines, do's and don'ts to protect them from infection, asking them to carry limited essentials, bring their own water and food, come by walk or cycle to school or transport following mask wearing, sanitization, and social distancing norms till they reach back to home. And from the parents perspective, because you know that parents are very worried about sending their students to schools when they reopen. So if we think about the parents have profound concern for their children before they think of sending their wards to school. The horrifying and terrible times have brought a paradigm shift the way parents look at education, since their children's health and well-being is more important than attending school. They have many questions in mind that must be answered well by the schools. This can be related to safety, inflection, class size, timings, commuting, school timings, etc. Parents do have different views and doubts to clarify as students are different from one another. Parents who provide access to electronic gadgets, internet, homely learning environment, and better learning opportunities would prefer online learning. On the contrary, other parents who cannot afford to provide access to online resources would prefer to send their children to school. The socio-economic disparity has affected the marginalized and the most vulnerable extremely in this pandemic. Schools should collaborate with organizations offering multiple learning resources, handbooks, activities, worksheets, and curriculum outlines, and guide and help parents create a positive learning environment in their homes by involving children in testing activities to keep continual learning. The students would accompany medical experts, evidence, and government guidelines advising that students and teachers can safely return to school which by all means seems unlikely today. And, and curriculum, if we think about the curriculum, we have to change all the curriculum, because an abrupt shift to virtual classroom largely turns into a traditional teacher-centered approach without any productive work and learning collectively, because the major activities taught in online class did not invite students' attention, interaction, and discussion on any topic. That's why you have seen that many students are connected with the online, but they are not listening to their teacher, they are not doing their work, because they have no interest on their online teaching. So we have to change the curriculum in such a way that students take interest on the teaching learning process, and we have to make our teaching learning process child centered learner, not the teacher centered approach, because that time has gone when we apply the teacher centered approach, and teachers will be the leader of the classroom. Now the situation has come that each and every children has given attention, and our teaching learning methods should be child centered method, like discussion method, creative thinking, like what you said, that problem solving method and the project method. So we have to apply these method in the online classes also, because the student feel bored and so no interest to attend the virtual classes. The virtual or online synchronous teaching misses the fundamental aspects of pedagogy, curriculum content of what is being taught, methodology and techniques for socializing children in the repertoire of cognitive and effective skills required to attain 21st century life skills. The teachers should transform to a more engaging learning style to make the teaching learning process more interactive, to come closer to face-to-face learning. The best way of fitting in present times is partially online synchronous and partially face-to-face learning for better teaching learning process. Both teachers and students should start to innovate and find some trusted learning sources to find high quality remotely and virtual learning tools to continue online pedagogies. Then only children will take interest in the online teaching learning process. Many organizations like Pearson, National Geographic, Khan Academy, Baizu, Elsevier, edX, Coursera, Future Learn, etc. have opened up access to a wide range of resources, scholarly content, and free materials to support teaching and learning in response to COVID-19, and free professional development certificate programs to engage, inspire, and motivate teachers and students. Therefore, the schools should redesign, incorporating substantial modifications in the syllabus to teach a constructive and broad curriculum in all disciplines, attending to all major gaps in students' knowledge till the time we regain normalcy, probably not before 2021. So if we see the technological perspective, the pandemic teaching would enforce raft of changes the teachers will have to make before and while reopening schools. Since the 1990s, we have witnessed monumental changes in the field of information and communication technology, which has altered our way of living, thinking, sharing of knowledge, content creation, and dissemination to the students. The tremendous and massive use of online virtual learning platforms using technology has brought in many challenges in online teaching and learning, initiating from lack of access to devices, mobiles, computers, and the internet. The testing times realized us to make use of different learning applications to find new ways to get answers what, how, where, and when teachers should teach and students should learn. Attaining digital skills transforms teachers not only to impart knowledge but can also create content, activities, and like students' interest and learning styles, and quizzes and assignments to guide and evaluate students' learning. The Organizations for Economic Cooperation and Development reports that dreadful virus effects underscore how well teachers are prepared and engaged in online learning. Hence, teachers need to be involved in planning so that technology does address their instructional needs. We need to ensure that no student is left out of the classroom by COVID-19 because of no device, interrupted power supply, no homely learning environment, and no technological support at home. Even if we open schools with set guidelines and standard operating procedures, adopting blended learning, the marginalized and disadvantaged background students will still remain the most sufferers because of the cited reasons: multiple intelligences, and low learners who lack motivation, curiosity to learn, resilience, and learning strategies on their own. The institutions should invite local bodies, NGOs, and agencies to arrange, support, and render services to provide equitable and inclusive access to education on digital platforms to underprivileged students by arranging electronic gadgets in community centers, local schools, or private centers to prevent any further loss to learning. This would bridge the digital divide in education and bring inclusive growth and learning to all learners to ensure the right to education. The best takeaway from the COVID-19 is to construct, develop, and redesign a new and concrete backup system that caters to individual students' needs and to meet any eventuality that we face today. This would further bring an end to the exam one size fits all in the education. And the most important, from the health perspective, that is very important, we have to care when reopening school. The students' health is paramount, especially in pandemic situations, and this factor should be accorded utmost priority before any decision on reopening the schools. According to Terada, mental health and academic achievement are linked. Research shows chronic stress changes the chemical and physical structure of the brain, impairing cognitive skills like attention, concentration, memory, and creativity. The COVID-19 pandemic is primarily a health crisis, and more than 190 countries have closed all academic institutions. The prevalent impasse the administrators faced today was first closing schools and now reopening of schools to continue learning. The virus can be contained by reducing the number of students in class on a day, using face masks, keep social distancing, monitoring movement in case one student gets infected, then for easy tracing and auto isolation, which is studied and decided on a case by case, class by class basis. The advisory should also prevent the movement of comorbidity elderly, pregnant, and vulnerable staff to attend school. Every school to be supplied with an adequate number of testing kits, and if detected some symptoms, may be handed over to parents immediately and keep a record. Similarly, the activities that invite gatherings like prayers, assembly, group discussion, singing, chanting, and praying together should be avoided. Schools should also consider staggering morning reporting times, break times, lunch times, and closing times to prevent any rush, crowd, and gathering. Students may be advised to walk or cycle to school, and those using school transport should follow guidelines strictly on the rules, advisories, modus operandi, and operating mechanisms should be disseminated to school staff, teachers, students, parents, and communities so that everyone will be aware about the guidelines. And if we see from the environment perspective, it is also very important because the environment perspectives lead us to think about two different aspects at home and at school. Firstly, the parents, if working from home, can create demand from teachers on, or download activities that can be done at home. Conversely, parents attending their offices face countless challenges to make both ends meet. Pandemic brought a huge challenge for all working parents to strike a balance between work life and home environment. Secondly, the effort must be ensured to sanitize the school campus to make it safe and infection free. Teachers should keep the classroom windows open to improve proper ventilation, quarantine items for adequate time before use, maintain health record, keep a record of students in each group, and monitor contacts with other groups, and avoid any gathering of students in corridors, and strictly comply by all guidelines and standard operating procedures to ensure food protection to the students. Because our concern to continue teaching learning, but we have to give food protection to our students. The other most vulnerable area is toilets, which need to be cleaned regularly, and students must be instructed to wash their hands thoroughly after using the toilet. The teachers should try to keep a distance from students in class and can arrange students sitting with forward facing desks. A big opportunities to three C's: cooperate, coordinate, and collaborate. That is much needed nowadays. We do believe that we unite to work together, change can happen. And we hope that soon we come out of this crisis stronger. This is possible only when we put our energy, knowledge, and resources by collaborating and working together. The teamwork, resilience, and high motivation of teachers can create niches in education to reinvent the wheel. A lot of organizations have come up to share their resources for teachers in the COVID crisis and vice versa. Teachers have formed groups where they share their content material, PPTs, videos, assignments, etc. to help other teachers with innovative ideas, practices, and instructional aids. This is not the time for competition. This is time for the cooperation. We have to cooperate each other. It saves times, energy, sharing knowledge, brings in a sense of pride and a sense of belonging to work in online community and knows what others are doing, consequently make things much easier than before. The cooperation, coordination, and collaboration at each stage would instead a spirit of compassion, empathy, and teamwork that can easily solve big problems and transform challenges into opportunities to learn, relearn, and perform better. The technology and artificial intelligence have taken us to sail smoothly through these tragic times and provided us opportunities to connect and share at global knowledge sharing platforms to enable us to become a part of the quality workforce and innovate culture to contribute a bit in Atmanirbhar Bharat as envisioned in New Education Policy 2020. So the question is how school will reopen post COVID. So I just give that few suggestion that 50% strength preferably with higher classes to be split into two groups and conducted on alternate days, different lunch hours for different classes, disinfecting classrooms and toilet frequently, no canteen facilities, no assemblies, sports games or other events, school buses with half capacity, more facilities for hand wash, and then mask vending machines, rearranging desks to maintain social distancing in classroom. And if we that few approaches given by the health and human services, and that is the first one is the increased social distancing. Is because structure and physical space modifications. Waiting areas have 6 inches space markings that we have to mark before opening the school. We have to give marking for the social distancing and that density limiting actions, stagger school hours or alternate days, weeks when students are in school, reduce class size. Suppose class size is 40, so we can like 20 in each classroom so that we can maintain social distancing in the classroom. Minimize opportunities for sustained exposure, limit group activities, because you know that if you do the group activities they have to chance to become closer, and that we have to avoid nowadays. And that is the arrival dismissal directly to bus and car. That time also when students go with bus, we have to maintain the social distancing between the two students. And the second approach is implement hygiene protocols that disinfect services and common spaces, implement systematic hygiene routines, and cloth face covering recommendations for staff and students. And we have to ensure that ventilation systems work properly or not, ensure water systems are safe to use after extended closure, minimize use of the shared supplies, frequent cleaning for high touch areas, provide hand sanitizer at every entrance exit classroom, ensure frequent refilling of hand sanitizer, soap, paper towels, incorporate bathroom breaks and hand washing breaks. And third approaches is monitor staff and student health. That is also very important. And establish enforce sick policy to support disease suppression. Instruct staff students to stay home if they are sick, if they feel fever or other symptoms. So if they have to better stay at home. Have a plan for immediate removal of sick individual and implement systematic symptom screening. Daily symptom screening for everyone at school entrance. School nurses, health personnel providing direct care should wear appropriate PPE, that kits, personal protective kits. Provide resilience and support services. Ensure access to mental behavioral health resources. Ensure access to school nurses services. Protect high risk populations. Accommodations for high risk staff for COVID-19. Update care plans for children with special health care needs. And approach for is provide education, proactive information dissemination and combating misinformation. Communicate to families about COVID-19 symptoms in preparation for the school reopening. Stay home if sick. Post signage and messaging to remind students, staff about physical distancing. Provide education and training on COVID-19 strategies for school staff. Then how to keep school safe when reopening. So PPT is not visible. I just 10 because it is very important. American Academy of Pediatrics has given that few guidelines, and you have to know about that is the clean and disinfect high touch surfaces. So we have to train our student, don't touch any surface, and because we have to clean every time these surfaces. Wash hands, masks for all adult and students. Desks we have to keep 3 to 6 feet apart. Fewer students and staff in the classroom. Teachers classrooms, but not the students. We don't allow students to move in the classroom. Lunches at desks. Use outdoor spaces when possible. Flexibility to go virtual if that any doubt of the virus in the school. So it is better to conduct the virtual classes. And it is also very health organization have given the checklist that ensure soap and water available or not, hand sanitizer is available or not, toilets are clean or not, so these schools are disinfected or not, and ventilation, increase good and respiratory hygiene practices, ensure safety. Students and staff should be separated without creating a stigma, and health authorities should be consulted whenever possible. So we have to follow these WHO guidelines. And at last, we have to conclude by saying that COVID-19 has impacted mankind immensely and brought a new paradigm shift the way we look at education today, where we see the children's welfare, health, and success more than just schooling. This has surfaced many inequities amongst learners that must be corrected in education to realize its ambitious goals. We need to redesign our systems of child development and education to ensure students, parents, and communities that schools are working to provide equal learning opportunities and equitable access to educational technology to close the digital learning gap. Removing the major flaws, the new modalities, new reforms, norms and reforms aligned with National Education Policy 2020 should expedite now to lessen the gap. Nation building is a duty of every citizen, and taking into consideration of all the major factors discussed above related to students, teachers, parents, administrators, technology, environment, and conglomerating of 3 Cs would indubitably pave way to innovate flexible pedagogy and ushering in initiating courses in latest technology beyond the effects of COVID-19 as schools reopen. We feel that the given perspectives will pave the way for the requisite changes that are obligatory to get ready and usher in meeting the expectations of millennial learners. The pandemic should not be seen adversely, but an opportunity to rise to the occasion to improve the education system, which will make it a win-win situation as and when academic institutions reopen. So I have taken this from references are there, and at last I would like to thank for patient learning, and very sorry for the internet today internet problem. So that I have to sorry for that. And at last I must thank you for your patient learning. So thank you so much. Yes, over to Badu sir, Dr. Badu sir.
Thank you, ma'am, for active presentation. Except only this internet issue, everything was
Yeah,
perfect.
so
It's
so sorry.
okay. No, no, no. It's okay. It's okay. So I also would like to add some points with your presentation. There are five important things which we need to follow when we are thinking to reopen the school. The first aspect is about like physical distancing. Both Mr. Bangu and Dr. Savitra Misra has served. Ensuring the social distancing between the students is very essential. Though we have the child is very keen to meet their friends after a long time and meet their teachers, so they may be very enthusiastic to mingle with them. So we need to educate our children to maintain a social distancing even with their friends also. And second thing, ensuring hand washing. Though in many government schools we are not having such enough facilities and the resources, and it is a question mark how we are going to ensure this hand washing frequently. So that we need to think of it. Respect to state government and the Department of Education needs to allocate a special fund to ensure this hand was all the and use of masks and these are the three important three things which is going to mitigate the risk of the children from infecting from the COVID-19. So these handmade masks are suggested by UNICEF, WHO, even in Ministry of Health and Family Welfare. So we need to ensure providing this reuse. Even the Department of Education can come up with distributing of free masks to the children, those who are coming to the school. So before entering to the school every day, they should get some masks, which will also mitigate the risk. And environmental cleaning is also essential. So after each session or twice in a day, all the places and surfaces need to be disinfected. So if we follow all those such items, so that we can ensure the safety of the children even with COVID-19 when we reopen this. So with this, I also thank Dr. Savita Mishra. Now I request the participants, if you are having any questions, you can raise. Ma'am, already there are a lot of questions in the chat box. I think we'll be able to see it, ma'am.
Yes, yes, no problem, sir. Yeah.
So you can take 7 to 8 minutes to answer some of the questions.
Okay, sir. Okay, sir. Can you read out questions, sir, from chat box or?
Yeah, sure. I'll read out. How the school is going to provide matching sanitation facilities is not the challenge or vulnerability.
Yes, yes, it is a challenge. Everything is challenge for everyone, for schools also, and for parents also, and from the students also. Because now we all have the equal responsibility. And when you know that since 6 months our children at home, and that already Padu sir has the told that even when school will reopen and our children will go to school, that they will feel very like excitement, and maybe they will not remember the protocols, the guidelines what parents have that taught in their house. They will not remember in the school, but then again when they enter into the school campus, it is the responsibility of the school administrator, teachers, and other staff to that remain active with the students, so they don't touch the other surfaces, they don't they have to maintain the social distancing, and they have wear a mask or not, and if their mask is not proper, so they have to change their mask. And sanitization, they have to keep a sanitizer at each and every corner of the school, and starting of the gate or classroom and toilet and every places where students have to go, and they have to that use that place. So it obviously it is a challenge for the schools, but we have to accept this challenge, because if we have to continue our education face to face, and if we have to the education system will not interrupt, because you know that online education is not reaching each and every student of our country due to the socio-economic background, so that we have to face these challenges. No option, we have to accept these challenges.
The
Yes,
second
yes.
question is from Lakshmi Narayana. I think there are a lot of, just a minute. Who is going to assure about the safety of school environment, transport or mobility and environment? Who is going to assure about the safety of school environment?
Yes, if you are a parent, and if you ask the question to me, because I am I am also a parent. I am also I am my children, my twins. I have twins that they are in class 11. So when the school reopen, they will also go to the school. And if I, as a parent, I am also worried about that. That who will take care of my children? So your question is genuine. That who will take care? Who will take responsibility to for safety of your kids? Yes, but uh, whatever I that in the presentation we have take that we have to remember three C's, that we have to cooperate, we have to collaborate, and we have to communicate. So if that you don't feel that your children is only your children, when your children will go to your school, then that is the responsibility of the school and school, that administrator, teachers, and on other staffs will take care of your kids. And like when your school start, when your students start from your home, means if your kids are coming from the bus, that they have trained, bus driver and the other that people conductor have trained to that, they have to that make the students to maintain the social distancing and use the sanitizer, and that for all other safety measures bus is equipped. And when they enter into the school campus, school is also equipped with all safety measures. So like I can't assure, but as an administrator or as a teacher, I can assure you that when you send your kids to the school, you can whatever, as a parents you are taking care of your kids, as a teacher we also take care of your kids. So because this is the cooperation of teachers, students, parents, and each and every member of the communities, because we have to take this challenge, and we have to fulfill it, because there is no option, we have to continue our education. And you know that day by day case is increasing. So this I'm not saying that tomorrow school will reopen. It may take 1 month, 2 month, or maybe the 3 month, maybe that in 2021. So that I want to that share that you have to that you have to also one of the part of this challenge, and you have to believe on the school authority,
Yeah,
because you have to take trust. Trust is the main
exactly.
factor.
Exactly. Yeah, you're right. And the last question I would like to just read out. One person has raised how much the teachers are trained with online education,
Yes, this
how much they
also
are
I have discussed.
perfect.
Yeah, this also I have discussed that we have never thought of this situation, because you know that we have never invited this situation. We as so that we our teachers were never trained about the online education. In like I am associated with teachers training college, B.Ed college. Even the teacher educators were not trained about the online teaching. Teachers are only thought that ICT in charge, ICT teachers will handle these on computers. The other teachers will just go to the classroom and give the face-to-face teaching. But when the situation will come suddenly, so believe me, I salute at from this platform. I salute our teachers. They have tried day and night. They have do their hard work day and night, and they have never stopped teaching and learning process even a single day. Even not my teachers, teachers from all over the country have continued the education. Even countries have locked down, complete lockdown, no movement, nothing is there, no shop is open, but teaching learning process is each and every house. Students are learning and teachers are teaching. Teachers are not doing their own work, they are not cooking their house food, but they have to continue their education. So now, but now that 6 months have gone and our teachers are fully trained. Believe me that I every day I am talking to not my teachers, like I have trained so many teachers, and my students are in Qatar, in Saudi Arabia, in USA, and I am connected with all those teachers. And in each and every country the situation is same, which we are facing the problem, and they are also trained, our teachers. And now the situation has such that our teachers are trained, they know how to that frame the question paper that on the Google form. They know that how to frame the e-content through PPT. They are teaching through PPT. They know that how to use different platforms. And I hope that this adds the quality of the education in future also. Yes,
Uh,
Dr.
Thank you,
Badu.
Dr. Savita Mishra ma'am, for briefly answering for all the questions. I think we are with the running of time, so it's better to conclude the session here. This program was being organized related to Prime Minister 10-point agenda on learn from the disasters, learning from the disaster activities, so that we can, for example, during this COVID-19 is an unprecedented situation, which we got some new learning. Even this COVID-19 or any disaster situation also, we can ensure the educational rights of the children. The same can be replicate in future also, to ensure, for example, if there is a flood or cyclone in some of the coastal area, the children might be affected with educational rights. So in that type of situation also, we can provide this online education to ensure the rights of the children. So hope this program has been very much benefited to all the school teachers, parents and children, and of course to all the participants, right? So on behalf of National Institute of Disaster Management Child Centric Disaster Risk Reduction Center, I would like to thank Dr. Savita Misra, principal from the Darjeeling, for made a wonderful presentation and to ensure the benefit of all the parents and teachers, and also extend my gratitude to Mr. Bangu, program officer from UNICEF, Bihar's State Disaster Management Authority. So once again, my sincere thanks to both the resource person and all the participants. Thank you so much to everyone. Thank you, ma'am. Yeah.
Thank you, sir. Thank you,
Thank
participants.
you, sir. I'll call you after 1 hour, ma'am.
Okay, okay, sir. Thank you so much.
Okay.
Then sorry, sir. Again, sorry, sir.
No,
Difficult
it's
with this.
okay. The percent is not, it's fine, fine.
Okay, okay.
Okay.
Thank you, sir. Thank
And regarding the certificate, we have provided the attendance link. I request all the participants to fill the attendance sheet, and we will check the attendance percentage. The participants who are securing minimum 80% of attendance will be provided with the certificate, and within 7 days, 7 working days. Thank you so much. Let us end the meeting now. Mr. Bangu sir, are you available? Mr. Bangu sir.